Welcome to the module Respiratory Syncytial Virus, RSV, in older adults, an overview. A frontline forces training presented by Superior Health Quality Alliance, or Superior Health. This learning module was developed for direct caregivers working in multiple healthcare settings who care for a variety of patients. It is also relevant for family members caring for a loved one in the home. Direct caregivers play a critical role in providing care to individuals in many settings of care. Because direct caregivers spend a great deal of time with those they care for, they are better able to recognize and understand the needs of those individuals. They are also more skilled in identifying when someone is experiencing a change physically or cognitively. The purpose of this course is to further your learning and build on your current knowledge about respiratory syncytial virus, or RSV. What you know and how you use that information improves the quality and safety of the individuals you care for. This learning module, RSV, and overview, is the first of a two-part series of modules exploring RSV in older adults. You are viewing the first module of the series, which provides a general overview about RSV in older adults. It is not necessary to complete the entire series of modules in one sitting. You can leave and return to any of the modules at any time. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. After reviewing this module, learners should be able to define respiratory syncytial virus, RSV, identify causes of RSV and those individuals most at risk, recognize signs and symptoms of RSV, and understand and describe how it is spread. RSV is a common respiratory virus which causes mild cold-like symptoms that usually last less than 5 days. Older adults may not experience any symptoms at all. RSV is a seasonal virus that most often occurs in the late fall and early spring. This seasonality can vary by location. It is important to understand that RSV is highly contagious and can spread easily among individuals. RSV occurs most commonly in those 65 years and older. Older adults are more at risk than children for contracting this virus. Individuals most at risk for becoming infected with RSV are those with chronic illnesses or diseases such as congestive heart failure or CHF, chronic obstructive pulmonary disease or COPD, and asthma, diabetes, kidney or liver disease, bleeding disorders, and neurological conditions. RSV may cause these chronic conditions to become worse. Individuals who are frail and or who have a weakened immune system, along with those who reside in nursing homes or other community living settings, are also at an increased risk of becoming infected with RSV. Preventing RSV in older adults is important because it can lead to worsening of other illnesses such as asthma, COPD, CHF, or pneumonia. According to the CDC, between 60,000 and 160,000 older adults are hospitalized with RSV each year. Between 6,000 and 10,000 older adults die each year due to an RSV infection. During the fall of 2022, hospitalizations of older adults were 10 times higher than usual. Symptoms of RSV typically occur 4 to 6 days after exposure to the virus. Adults with RSV usually have mild or no symptoms. Signs and symptoms of RSV are very similar to a common cold and include a runny nose, cough, sore throat, headache, fatigue, and fever. These symptoms generally occur in stages and not all at the same time. Some adults may develop severe symptoms that lead to pneumonia, hospitalization, and other complications. RSV is spread by an infected person coughing or sneezing. When that occurs, virus droplets from their cough or sneeze can either enter an individual's nose, eyes, or mouth. RSV can also be transmitted when a person touches a contaminated surface like a doorknob, table, or medical equipment. Studies have shown that RSV can survive for up to 6 hours on hard surfaces. The virus can live on soft surfaces like tissues and hands for up to 1/2 hour. Contact and droplet precautions should be implemented when someone is suspected of having RSV. We discuss prevention and precautions in the second RSV module in more detail. Individuals with RSV are usually contagious for about 3 to 8 days and may spread it to others. They may actually be contagious a day or two before they actually start showing symptoms. Adults with weakened immune systems can spread the disease to others for as long as 4 weeks, even after they stop showing symptoms. Prevention is the key in preventing the spread of RSV. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Respiratory Syncytial Virus, RSV, in older adults and overview quiz on the Frontline Forces webpage or in the YouTube description below. This material was prepared by the Superior Health Quality Alliance under the contract with the Centers for Medicare and Medicaid Services, CMS, an agency of the U.S. Department of Health and Human Services.